The Clarion Call Care Group and Nisa Medical Group have called for more care and support for organ donors across the country. The groups made the appeal at the 2023 inaugural Living Donor Day celebration, organized to recognize and honor selfless individuals who had donated an organ in Abuja.
We are really thrilled to have everyone here. Your time that you are spending with us is valuable. The most valuable asset you have is your time. And so we really appreciate you spending the next few hours with us. This is going to be a remarkable event. I think that you will enjoy what we have to present. And thank you again for coming.
Dr. Ibrahim Wada, founder, Nisa Medical Group, said the event, which is the first of its kind in Nigeria, was organized to connect and honor individuals who had given the gift of life to others.
I say to them, your courage, your compassion, and your generosity have touched the lives of countless individuals and families. And for that, we thank you. We want to provide a platform for living donors to share their experiences, to connect with others who are on similar journeys, and to receive the support and care that they so rightfully deserve.
Mr. Joseph Umar, the first kidney donor in the Southeast, said inadequate awareness had remained a setback to the donation of organs, especially kidney, to those in need.
Let anybody who is listening to this take me as an example. I had all those fears, but I try to encourage myself. I have to shift aside all those fears, because I looked at the front and I realized that what stands in front is greater than what is at the back. So I'll encourage any one of us here, because either it happens to you as a person, it can happen to you as a wife, as your child, or your relative. Kidney problem cuts across. There is no boundary, because it can happen to anybody. So take it from me, you will have some discomfort because you are a human being, but after a while everything will be okay. So there is no need to entertain that fear.
Miss Mary Brown, a nurse from the United States of America, said the event was also aimed at appreciating persons who had donated one of their organs to save the life of others. She said it was important for Nigerians not to be scared of donating, as it is fulfilling to see someone come back to life because of a kind gesture.
For us in the United States, we celebrate an entire month. It's in April, and we celebrate all living donors, because in some instances you can give more than just a kidney. But Dr. Ikwena is a transplant surgeon, and we were celebrating all of the transplants that we've done here, which was a total of 13. And we wanted to give a special thanks to the donors that allowed those other patients to continue, get off dialysis, have a better quality of life, and hopefully a longer quantity of life as well. So for us, it's really important to let the donors know that we care about them, we care about their health. We want to be a resource for them so that we can take care of them if anything happens. And so we know that that doesn't necessarily happen, and we wanted to ensure that anybody, not just the people that we've transplanted, but anybody that has donated, reach out to us, because we want to be able to help with resources for the donors.
Mrs. Miriam Onuoha, member House of Representatives Imo, said it was important for the country to have legislations on insurance for living donors in the country.
Legislation and humanity and representation go together. Good governance and all of those are intertwined. And that's why I'm here to offer our legislative intervention on the promulgation of the Living Donor Protection Bill. Like you are aware, the National Health Act of 2014 talks about issues relating with blood donation, transfusion, tissue transplantation, and organs. But a lot more needs to be done as regards welfare and aftercare for the donor. I believe that if we allay those fears and set this foundation straight, we would have a pool of more donors who will be willing to come for the testing and donating this gift of life, capable to breathe a new life to others.
Miss Evelyn Abraxon, a living kidney donor who shared her experience after donating to her mother, added that it was fulfilling to give someone another chance to live.
My story is bittersweet. I say bittersweet because I donated to my mom, and sadly she had complications and she passed. She had a stroke after the transplant and she didn't get to enjoy the kidney. So I call it a sweet story, but she got to live for almost 2 years. She was comatose, but it gave us an opportunity to see life in a different way, and the whole journey has changed my perspective in life. I have a better understanding of what your kidneys are to you, and so I don't sweat things in life. If I had another kidney and someone had a need for it, I'll still give it. So being a living donor it's just being joyful that you give somebody else hope. And even though my mom didn't make it, I am happy that I took that decision.
The News Agency of Nigeria reports that the high point of the event was the launch of a book titled Priceless, authored by Mr. Joseph Umar, the first living donor from Southeast Nigeria.
Put our hands together, ladies and gentlemen. It's done. Wow. Priceless.